Good morning. Happy Friday to everyone. We're so glad that you could join us today. I'm Rachel Gage with Palliative Care in Wisconsin, and I'd like to introduce our two speakers today. We've got Lindsay Lederman. She is ATR BC, ATCS, LCAT, and LPAT, all the certifications. She's dedicated her career to bringing art therapy to children, teens, and adults with a strength-based humanistic approach. Her undergraduate degree is from Brandeis University, and her master's is from the School of Visual Arts Therapy program. She's got a strong foundation from these two programs, both in and out of the classroom. Lindsay began her career in 2007 at St. Luke's Roosevelt Hospital in New York City as the first art therapist in their child and family outpatient clinic. And in 2014, she moved on to start the first art therapy program at Nemours Hospital for Children in Delaware. She's been featured in Thrive Global, presented at top New York City hospitals on the efficacy of art therapy, and was involved in a full-length documentary about the use of art in the grieving process. She's also been published in the Canadian Art Therapy Association Journal and the Journal of Palliative Care. And then we also have Sarah Rubin, MA, LCAT, ATR, board certified, and CCLS. She's a licensed and board certified creative arts therapist and child life specialist based out of Nashville, Tennessee. She received her master's in art therapy from New York University and her child life certification at Kravis Children's Hospital at Mount Sinai in New York City. She was the first duly certified art therapist and child life specialist to service the adult palliative care team at Mount Sinai Hospital, and she facilitated art therapy and child life sessions at the bedside. She developed other therapeutic art therapy and child life sessions there, and an art-based memorial service for children who lost a parent or sibling, and a creative arts magazine that features artwork created by the patients, family members, and staff. She's presented nationally and internationally on art therapy in the medical setting. She currently teaches medical art therapy to graduate level art therapy students at New York University. She's authored various book chapters and journal articles on the subject of art therapy, palliative care, and supporting children through end-of-life experiences, grief and bereavement, and self-care for clinicians. So I'd like to welcome these two ladies to talk about exploring the intersection of art therapy and palliative care today. Thank you. And participants, if you want to put any questions or thoughts in the chat box, we'll be sure to address them.
Thank you, Rachel. Thank you so much. It's such a pleasure to be here with you all today. So thank you for inviting Sarah and I to spend this morning with you. As you heard, we're going to be sharing a little bit about art therapy in the palliative care setting. We'll take you through a bit of an overview. I was very excited to see a fellow art therapist on the call, but for others who may or may not be as familiar, we'll go over a little bit about art therapy in general. And then we're really here to share with you about specific art therapy uses and examples within our practices. And as we get started, to note, you will be seeing artwork done by patients. All have been consented to share for these educational purposes today. And I'll let Sarah take it away.
And this image that you're looking at here is, a typical bedside session that you'll see, if you ever enter a room and see an art therapist working at the bedside with the patient. So this patient was using oil pastels, and of course you could recognize the hospital table. I think she's sitting on her bed. So art therapists are oftentimes very creative in the hospital setting and, facilitating art therapy sessions in ways that are most comfortable to patients. So just to begin, art therapy is a mental health profession. A lot of other practitioners may use art in their kind of process with patients, but art therapy, true art therapy, can only be facilitated by an art therapist. Art therapists have master's level training, and all those letters behind our name, those are board certification or licenses by the state. Art therapists, in addition to having specific training and internship experiences, do have to have continuing education credits every 5 years. So we do have a recertification process as well. Art therapy itself entails the use of art media, the creative process, and the resulting artwork to help individuals explore feelings. Art therapy can help reconcile emotional conflicts, communicate, foster self-awareness, manage behavior. And of course, in palliative care, there's so much more related to end-of-life issues such as legacy building, which we'll go through some examples there, connecting with the self and others, and again, managing all of the feelings that come with having a severe or life-limiting illness. Art therapists have knowledge in visual arts. We have knowledge in the creative process. We do have knowledge in more technical aspects of creating art to, again, help a patient create a piece of art that will last. A specific example I can think of is if you're working with clay, art therapists have to know how to slip and score and utilize a kiln setting. So there are some technical things that art therapists know that are specific to the creative arts process. But on the other side, we also are well versed in human development and psychology and counseling theories. So you can think of an art therapist as a therapist who has some advanced training in art. Many people say, oh, how would we know to consult an art therapist? Any person who's having difficulty coping could benefit from a visit from an art therapist. We have an organization called the American Art Therapy Association, and I have the link there if you're interested in learning more about our educational standards or just more about the profession in general. You can visit that website. So art therapy in palliative care, we are trained again to explore issues using the metaphor and using the symbols that one creates in an art product. We also really look at the creative process and what might be healing about that when a patient is engaging in an art therapy session. When someone is creating art, there's so many other things that are happening. The person is problem solving. The person is maybe working on a new skill. In terms of children and child development, there could be some fine motor skills that are developed through an art therapy session as well. So the goals, of course, are psychological, but there are some other goals as well that can be wrapped into an art therapy session, music therapy session, any creative arts session that can, address the biopsychosocial needs of the individual. We know that illness causes a great amount of stress for the patient and the family. So art therapy is oftentimes used to manage that stress, manage anxiety, and even manage physical pain. And the examples that we have following this slide are going to walk through some of the big examples of art therapy referrals in the palliative care setting. So we're going to talk about pain, we're going to talk about legacy and end-of-life issues, and we're also going to talk about family support. So we'll just dive right into pain management first.
Thank you. So I think one of the things that I just wanted to piggyback that Sarah shared just now was about consult and why art therapy is used in palliative settings, and really want people to walk away from here knowing that art therapy is not for people who like art necessarily. It's not for people who consider themselves artists. It's for anyone. We as art therapists are trained to help support people who are less familiar with the art process to be able to engage so that they can really see the benefits of this type of therapy. So in saying that, this is an example from the hospital when I was working and a common consult was for pain management. Very often there would be patients who were either at the limit with the types of medications they could use, but were still experiencing pain. And so very often the consult came through to find a way to support these patients in their ability to tolerate what they were going through at end of life experiences. This technique is kind of like a body mapping technique that I began using. And really one of the origins of the use of this body mapping was based off the ideas in the gateway theory of pain control. We've all heard those stories about the marathon runner who breaks their ankle and continues to finish the race. How are they able to do that? So there's really this, and those of you from the medical community can speak to this much better than I can, but in general, there's this ability for the mind to basically be distracted, to be utilized in a different way that helps us tolerate pain, even though the pain is still there. So with this patient, we started out doing a body map of what current pain looked and felt like. And what I really have patients do is do a scan all the way from head to toe and consider what their pain might look like if it were an image? So what color is it? Is it big? Is it small? Is it sharp? Is it dark? Is it light? Is it filled in? Is it all those questions I ask people to consider. And we fill in the body map with those images to really now externalize. This is what my pain looks like. It's not just inside my body. I can have a relationship with it. And that's very often something with art therapy that we want to help patients do, is know that their thoughts, feelings, physical experiences are quite real, and we can have a relationship with them. It helps give a sense of control. So once this is externalized, I ask the patient to join me in a guided meditation. It's pretty brief, and it really goes through, again, head to toe, with eyes closed if comfortable, imagining, using what they see in their first artwork, imagining those drawing images change. What would it look like if it were less sharp, if it were less red, if it were less burning, if it were less painful? What would these images change into? So again, we're using the technique of being able to visualize pain as a physical object and using the mind to transform it. We come out of the meditation to do a second body map. And here you'll see when I ask the patient to then show me what she was able to transform her pain into, what she wanted it to change into. She described it as light bubbles flowing through her body. They were light blue, all of them. The harshness of the red went away. The suffocating blue in her chest dissipated. And though very, very small, the smile on the image's face got a little bigger. Now, again, this did not take away her actual pain, but what this process allowed her to do was use mentalization in the art process to change the way she experienced her pain and have some control over it. So there's the physical aspect of creating the art. There's the use of the mind to distract itself, and the power of control to transform what we might be feeling. Not only is this a wonderful kind of acute consult when someone is experiencing pain, these are two images now that, Sarah referenced this. These are physical objects this patient kept in her room. And I went through with her pulling these out or doing a new one on her own. So again, this becomes a skill that she can use throughout her time in the hospital, that she can pull out. And these might change over time depending on what's going on, physical effects of the illness. But this is a skill now she's learned, and certainly doing it with me and guided by the art therapist, especially for the first time, is extremely important. But this became a skill she was able to utilize throughout her time in palliative treatment.
Thank you. I love that example. And two, helping people connect to their imagery in meditation that they do on their own, encouraging her the next time she experienced pain to close her eye, to really remember and feel what the bubbles feel like in the body. There's so many things that can kind of happen with the art process when the patient's alone. And I think that's what Lindsay's referencing too. Art therapists are helping people develop coping skills and coping strategies that they can use long after the actual art therapy session. And another thing too about pain management, of course, this is a beautiful example of directing the art intervention to a pain experience. But we are all familiar with the concept of total pain, coined by Cicely Saunders, of course, and art therapists really look at social pain, spiritual pain, emotional pain. We can address those kind of pain experiences to lower the total pain experience as a whole. And so while we can promote, pain management through art, we can address the total pain picture and help to reduce pain in that way as well. And we know for young patients who have young children, one of the major sources of pain, which can sometimes be experienced as physical pain, is social pain. What's going to happen to my child, when and if I pass away? And so that's really where my passion comes in, marrying the child life aspect of my training with art therapy. But what I love about art therapy, it is, art and play are the first language of children. And so when you're supporting a family and when you're supporting the youngest members of a family, providing art at the bedside can be a way to welcome the child into the experience in a way that feels safe and non-threatening. These are two examples of many that I have created by school-age children who are visiting their parent for the first time in the hospital. So if you direct your attention to the left, you'll see an image of a house. This child just learned of the diagnosis of her father, cancer diagnosis. And we're exploring how home life felt. Of course, her life basically felt like it was turned upside down. Dad was in the hospital a lot. Mom was with dad. There were new people picking her up from school. Her life really was in turmoil and feeling very dangerous and vulnerable. And you can see, I don't know if actually you can see, but there is a model magic, a clay form that she created. She actually threw on top of her house to describe this experience of her home life being threatened. Again, this child was school age. She didn't actually have the maturity or the verbalization to express her inner emotional experience, but she showed me using art, using play, using some of the creative process to express what she was feeling inside. And so that was a really wonderful moment of her, again, externalizing some of her feelings. For me to show mom this image, this is how the child is feeling at this moment. It can be really eye-opening because a lot of people say children are resilient, and children are resilient. But whenever there is illness now present in a family, children can sometimes be, left at the wayside, not be informed. And so what I love to do with artwork created by children is to really advocate for children's needs as well. Children deserve information in a way that they can digest, and they deserve times to process their emotions as well. The image on the right is an image created by a young girl, created at the bedside for her mother. Again, this child cried very often, and you can see that also is reflected in the teardrops or raindrops in this drawing. And really what I want to emphasize in both of these images is it can be so difficult to express how you're feeling about a big life event, child or adult. And so artwork can really help people express their emotions, again, gain some distance, look back, reflect on it. We know that illness welcomes complexity around feelings. We know that multiple feelings are felt at the same time when dealing with illness. So to have different images that express different feelings can be very helpful in children, especially labeling feelings, identifying feelings. That's what really supports long-term coping, having, the language to describe an experience and to process an experience. To piggyback on some of the family support, but then to go now into legacy building and end of life, there are really specific things that our therapists can do to promote legacy building. So these are just some hand printing examples that we facilitate at the bedside. The two images on the left were created in a pediatric palliative care environment. This child, it was a young child who passed away, and the parents were, of course, very upset and distraught over this. I suggested creating a hand mold as a way to promote touch between the parent and the child. Sometimes parents don't know how to interact with their child when their child is in the bed unconscious, not being the child that they know and love. And so there are art interventions that we can do that can welcome therapeutic touch from the patient from the parent to the patient. So in this case, we created a hand mold of the child's hand. There was a beautiful hand washing ritual that we did afterwards that was, I think, very healing for the family. And of course, we mentioned before, art can last, art can be preserved. And this was definitely a memento that the family held on to in their grief process. Another thing that we think about too is what's happening in the art experience for the entire family when we are facilitating family-based art therapy sessions. So I can direct your attention to the right image. You can see there's a child and a parent engaging in a hand printing exercise, just using ink and paper. And again, we're thinking about promoting touch. We're thinking about reinstilling family roles in an art therapy experience. So again, we're not solely focused on the artwork, but again, the process. Does the process promote connection? Does the process feel healing? Does the process feel comforting? We know that again, it can be very difficult to express complex emotions. And so one way we utilize art is to help people express the various emotions they may be feeling. And I wanted to show this slide specifically to highlight that we have a range of materials at our disposal to facilitate that. So art therapists are educated on, what is evoked when a person is using a particular art material. You think about people who are going through bone marrow transplant or going through, a waiting process with transplant, and maybe they're hospitalized for many, many months. There can be a level of sensory deprivation that happens when you are in the sterile hospital environment for days on end. So an art therapist might think to bring organic materials like clay to kind of reawaken or enliven the senses. Bringing in natural materials, if it's permitted and safe, like leaves and grass and things like this, can all be very healing for patients. And here you can see the patient using clay. This was someone who did not want to do art. He thought art was for kids, and here he is making this amazing mask. He loved the idea of carving, and I think there was something very specific about that, as his body boundary was invaded very frequently with IVs and surgeries and things of this nature. So there are things that can be present in the creative process that can reverse this kind of passive patient stance to a more active one. And that reenactment that happens in an art process, again, can be very healing, can help people process things on a nonverbal plane. But this patient, another thing that he really grappled with was his anxiety. And he mentioned to me every time he worked with clay and there were little cracks in the clay, the very act of smoothing over the clay and creating kind of this, again, smooth texture helped him to feel like he was smoothing out his own life, kind of helping him deal with anxiety. So there's so many ways that patients find meaning in their art experience and relate it to, their real life issues.
Thank you, Sarah. I love seeing the examples both with kids and adults. And I think I just really want to briefly share that art therapy and art making, we're trying to share the benefits with you about using this with patients, but we as clinicians, if you are a doctor, if you're a social worker, if you are any part of a palliative care team, this work is taxing, difficult, and takes a toll. And I think one of the things we wanted to just put out there is that this can be something, art making, art therapy can be a process that you do for yourself within a team, at your hospital, a group, or just on your own, to promote moments of reflection and self-care, to be able to tolerate some of the intensity that comes with this kind of work. So I know we are going to have time for a Q&A, but please, if you do have an art therapist on your team, or if you're somewhere, you can reach out. Sarah's going to share some resources. Find an art therapist who can come in and do a workshop or a group for your team. This is incredibly beneficial to stave off burnout and those types of feelings. So if you have specific questions about these art pieces, we can talk about it later, but I'll pass it back to Sarah to share some important resources.
Yeah, we're just going to end on some resources. So I helped to develop the art therapy toolkit for palliative care teams who are looking to add an art therapist to their team. So this is the link here. And I believe it's a free toolkit. So anyone who can access the website can access this toolkit. And in the toolkit, you will find foundational articles about the use of art therapy in palliative care. You will find practical items for an art therapist starting out. So things like what consent forms to use when using art in hospital-wide events or even in presentations like this. I also have a bereavement book list that's really great. Anyone can download and just print that out and have in your kind of binder of team resources. And if you're interested more specifically in art therapy and art therapy in different populations, you could visit the second link we have on the screen. Those are 2, 3, and 4 minute videos of how art therapy works with specific populations. And we'll just end on this image here. This was a mural created by children who lost a parent on the palliative care service. And this was an art-based memorial service that I facilitated with the chaplain. And what I really want to highlight here is that art therapists typically play well with others. We love collaborating with other psychosocial members on the team. We also value, of course, the medical personnel are on the team, and we like to, again, best support the patient and family. Art therapists, I think, are very aligned with palliative care doctors in that way. So we hope this was an informative session. We're going to, hand it over to questions. And again, we thank you for your time.
Thank you. Excellent resources and information. I see Marty with his hand up.
Yeah, I had two things. And of course, first, thank you both, Sarah, Lindsay. That was wonderful. I think the most important takeaway for me is a reminder that when I'm dealing with complex pain, I have more resources than just my medications. And I need to be more aware of that and reminded of that. So this was very helpful in that. The second thing is I'm looking down at some of the notes I took, and I think it leads me to a question. I mean, you guys are a mental health profession. The goals are psychological. I can imagine that you might sometimes unearth trauma. And if you're not a professional, and you are, but if somebody was just sort of doing this not as a professional, that there's a chance of causing harm, like any mental health profession. Can you guys talk maybe a little bit about the potential for harm in this field, and how you guys navigate and avoid and mediate some of that?
Yeah. Marty, I just so appreciate your thoughtfulness and that question. It's so interesting. When I was working at the Children's Hospital, there was wanting to promote artist in residency programs and visiting artist programs, artist volunteer programs. And one of the most important aspects, and Sarah brought this up in the beginning part of our presentation, was about our training and our ability to work with clients. So having that and knowing how to go in a safe way, how to look for cues, both verbally, non-verbally within the art, when things are starting to come up, certainly that can get mediated through intervention, again, both verbal and in the art process. Other times it comes up, and luckily, and like you mentioned, and I appreciate your awareness, we're trained to be able to support clients through that. And certainly that could be within the moment. It could also be to connect them with ongoing mental health resources, which I think is a really important part. Depending on the art therapist's role in the system, they may or may not be able to continue to see that client. So that might be advocating and helping support ongoing mental health treatment. That being said, I know that people in the hospital system who are artists, who are visiting artists, artists in residence, that is something I advocated for greatly, that they all be supervised by an art therapist, so that if they are doing art, because there's such benefit to those programs, if they are doing art with patients and things come up, number one, how do they handle that? They can come to someone with the training, and it impacts the artists themselves. Like, that's a lot for someone to come in and deal with. So we also support them and their reaction. So Sarah, I don't know if you had anything you wanted to add to that.
Yes, I think for any art-based volunteer, helping them understand their scope, because also it can be hard, suddenly you're working with art and then something pops up, giving them some basic training to understand when they are out of their scope of practice and when they need to, contact an art therapist, or if there's not an art therapist, a social worker, another psychosocial provider who's trained to provide some containment or provide resources for that person. On the art therapy toolkit that I mentioned by CAPC, there's an article on there that differentiates the role and responsibility of the art therapist and the art-based volunteer. And it talks about the ethical implications of, having art-based volunteers. And of course, there are a lot of times where art therapy is consulted and the patient is just bored, or the patient, they don't need that, specific support, but they would really benefit from an art making process.
Sure.
Art-based volunteers are perfect resources for people like that. So I love having these art-based volunteers, because many times there's only one art therapist, and the art therapist can also be stretched pretty thin. So it's great for art therapists and art volunteers to work together, but the very first thing that has to happen is an understanding of scope and when the volunteer is out of scope.
Thank you.
So I had a quick question. How do you approach hesitant providers who are not seeing a great benefit in art therapy or music therapy, or, you know, sort of these adjunct therapies that can be so immensely supportive for our patients? I've just heard in discussions and in certain circles, you know, oh, well, I don't like art, so I'm hesitant to recommend it for my patients or something like that. What's your elevator pitch for these providers to help sort of help them understand the benefit of this for their patients? And like Marty said, this can be another tool in our provider toolbox to really support these patients through this difficult journey.
Yeah, I mean, for me, whenever I started off, a lot of people don't know what art therapy is, and people don't understand how it works. And people have what art therapists call art trauma. They had a really bad art teacher growing up, so they don't like art anymore. They don't like to get messy or whatever it is. And sometimes one's own personal experience can be projected onto other people's experiences. So what I love to do personally as a provider is to share examples, doing, sharing like talks like today, showing pictures. I love welcoming in people into our sessions so they can firsthand witness the benefits. So again, I think it just goes back to education. Even facilitating a self-care workshop for physicians so they may benefit from or experience the firsthand effects of an art experience. That can be very helpful. But yeah, there definitely is some convincing that can happen. And especially working on the adult units, a lot of people may think that art is for children, or they may think that, they don't have time to do art. And so finding creative ways to, get in there in some way, build a relationship. When I enter a room, I go in with no agenda, and I also usually don't go in with art materials. My focus is, again, to introduce myself, introduce what I can do, build the therapeutic relationship, create an environment of safety and trust so that the patient is more comfortable and willing to experiment with something they've never done before. And so, yeah, my elevator pitch, just to circle back to that concrete question, is art therapy is a way for people to express themselves. We don't even have to do art. You mentioned, Marty, earlier, there are so many more resources than I remember for complex pain patients. And so really understanding why the doctor is struggling with a certain patient and tailoring the elevator pitch to that. Oh, your patient is really teary today and needing a space to talk. I can be that person for that patient. And sometimes I remove art from the conversation and again focus on the therapeutic relationship, and then from there we can weave in some more creative modalities.
Wonderful. Well, thank you both for your time and the reminder to lean on our art therapists in our clinical settings. And we hope everyone has a beautiful Friday. The weather looks like it'll be nice. Enjoy your day.
Thank you all so much.
Thank you.
Thank you.